Serious challenge like paralysis. That and that is why I had to come for that surgery. I think that surgery was done on the 13th of March, and after the surgery, it was a package of 7 days, and after that, I came back for removal of sutures, and after 6 days of the 7 days package, and later on, we had some challenge.
Like what?
See that I started experiencing some numbness, electric shocks around my lapses, electric shocks, knees, then all over my body. There was serious numbness, and they had to rush me.
Did you feel any kind of tingling sensation also?
What?
Tingling sensation, pinching sensation to your hand, fingers?
Well, yes, there is numbness to the fingers.
Okay.
Fingers, numbness, and down to the back, to the legs, that made me not even move, difficult to move. And I was rushed to the hospital.
And what you did for that?
Well, when I started experiencing some pains around the operation area, I had to come back to the hospital, demanded for drugs, and they gave me some drugs. And I took those drugs. That one did not even help at all, and I had to come back to the hospital, but there was no help. And then
You was comfortable to sleep or not?
not at all. I couldn't sleep.
How you managed that?
Well, it was very painful, very painful.
Then how you were managing that?
Well, there was no help. That is why I had to call the hospital.
Okay.
That we have some challenge, and immediately. I think after a series of contacts with the hospital, there was no.
Were you able to move your head as you are moving now?
Hard.
Head and your normal movements, like you are moving your hand now, you are scratching yourself.
Well,
moving
the hands, I was able to move, but when I came to the hospital, I could talk. It didn't stop me from talking. The hands, at least I could walk. It was difficult for me to move, to check.
Okay.
Very difficult. But all along, the numbness was there at the hands. The numbness was there.
Then after physio, how much better you are feeling that?
Well, when I came, came on the 18th of last month. That was April, 18th of April. Then when they saw everything, they said, okay, they will be able to manage it, the hospital will be able to manage it. Then we started the physio the next day. And along the line, yes, of course, we started the physio, and there was serious contact all along. But you could see now, it's not like before. Before I could not move, but now I think I can move very freely. And,
so like your movements. Do some movements so I can see you better, that you are able to move that movement was not able to move before.
Yeah, of course, you see, I can move, I can work very easily, all along. Unlike before, it was not possible. I was being guided by people, so that even now I can bath on my own. I can bath. Even though there are some impairments in the right hand, but see that the bath.
Okay. How strongly you think that physiotherapy is much better than medicine?
Well, I think physiotherapy, to me, based on what we experience here, I think I can say it's good. Though I cannot, in fact, I cannot compare. But the physiotherapy is very good because it helps one to move. But
would you like to recommend some other patients who are suffering from pain long after surgery, and they are not looking for any treatment? They are eating medicine, and they are...
No, taking medicine alone is not enough. Taking medicine alone, I think even as you take medicine, you go along with the physiotherapy. It's going to help a lot. But when one concentrates on the just drugs and medicine, I think it will not be enough to take care of them. It has to go along with.
How strongly you want to recommend the people to go to physio?
No, very well, very well. They need to go to physiotherapy.
Because sometimes, like your shoulder pain, it cannot be cured by the medicines, right? As you experience it here. So there's a lot of patients like you.
I recommend physiotherapy for people who have gone on through surgery. You see, once you go there, it helps, it guides. And even after you go home, you go for that, you use the techniques of physiotherapy, it's going to help you to go along, even if you don't take drugs, medicine. Sometimes it goes a long way to help you to do a lot of activities at home, based on recommendation from the physiotherapist. I think that one is good. But when you depend on solely medicine alone, I think it's not going to help at all. When you sit down in your room and take medicine without the physiotherapy, I think it's not going to help. Once they go along, it's good. And
I hope you are happy with this physiotherapy session.
Of course I am.
And in future, if you feel any kind of pain, you will like to see the physiotherapy first.
I don't pray to have any future pains.
In case you will recommend to somebody else, if you will say anybody,
if there is anybody
except medication, so you will recommend him for physio first.
Of course, if there's anybody I see him in a particular with such problems that I know physiotherapists will help, I'll recommend them to go for it, because that one they're going to really help in doing that.
Thanks for your kind information.
You're welcome. Thanks a lot. I think I must commend the physiotherapist here in the Pramos Hospital, Dr. SK. They've been very good. I think they have a very good experience, because when they started, I look at it as it's not going to be anything, but gradually I saw a lot of goodies in them. I think I must commend them for a very good job, Dr. SK and one of his colleague, Obin. They did a very good job on me, and I think I commend them because they have a very good experience in doing their job. I can anybody that will definitely come here, I will definitely direct that they should come see these two guys, and
thank you.
They're very good. They're very good. They have a very good experience, and I cannot forget them. I must remember them anywhere, because of a good job they did.
Thank you so much for kind.